Welcome to the HealthSpark, Igniting Healthcare Management Change and Evolution. I'm your host, Dr. Raya. Hi, I'm Dr. Raya with the HealthSpark, and today we have Allie Trimble Lozano, who is a best-selling author, former regional vice president and market CEO. She's a nurse leader, a public speaker, a hospital operations expert, a leadership coach, and a mother. So welcome, Allie.
Thank you so much for having me. I'm so excited to be here.
It's a pleasure. I'm so excited to talk to you about a ton of things. I'm afraid this is going to take all day, but we'll get started. So my first question for you is to tell us a little bit about your story, however you'd like to approach that. Tell us about yourself.
Sure. So I like to say born and raised El Paso, although I was actually born in Cruces and moved here when I was 3. I think it still applies, but I'm a proud UTEP grad and have continued to live in El Paso and give back to this community, hopefully for many years to come. You mentioned I'm a mama, so I always say my #1 goal in life is to raise a good human. So definitely working on that. I think I had several years in corporate America and enjoyed that and learned a ton from it. But I think after many years in that kind of circle, it was time to try something else. And so here I am. Nurse, you mentioned, so always and forever will be. I think nursing is definitely a calling and something that many people are drawn to, but it's something that I'm very proud of having done. And will continue hopefully to be a nurse until forever. Working on kind of what's next and trying to figure out really what I want to do, expanding my sphere of influence a bit with some recent changes. Wrote a book you mentioned, which was something I never really even thought about doing. But really my passion still sits with leadership and more so leadership in the healthcare niche.
Awesome.
So yeah, that's kind of where I am.
So tell me why did you choose to become a nurse? Let's start there. Like, what drove you to that nursing pathway?
Sure. So actually, there were a couple bumps in the road. I was in nursing school, or I'd actually applied to nursing school, finished all the prereqs, and I got sick. I was in the hospital, lost my spot in nursing school, and thought, well, I'll just go into accounting. I wanted to finish by the time I was 21. That was a goal of mine. And so I switched majors and I went to accounting for 1 day, Ginger, and was like, yep, this is not for me. Math is not my thing. So I sat out a semester, reapplied and went on my way into nursing. But I think to give you a little bit of history there, it was my grandfather, my papa, as I call him. And he's been gone for many years now, but he was very sickly towards the end of his life, and seeing kind of what he navigated and what he went through, and wanting the opportunity to be there for other people as they are at their worst. That's what got me into nursing in the first place.
And so what did your nursing journey look like? I mean, I think when I've met several nurses, I think a lot of them are like, I'm just gonna be a bedside nurse. I'm just gonna be. So what was your nursing journey like? And did you intend to be a hospital CEO when you started?
Lord, no.
Nursing journey?
Yeah, definitely not. So for sure joined nursing to be a nurse. Thought I would always be a nurse, bedside, taking care of patients. I never did floor nursing. That was something that I actually launched straight out of nursing school before I'd even graduated technically in the PACU. And I fell in love with the folks there, and I stayed there a little while after graduation, but really found kind of what I think was my clinical love of nursing in interventional radiology, trauma, and cardiac cath.
Okay.
So I did that for several years. And that's still, I say all the time, if I fail at this, maybe I'll go back to that. And it wouldn't be going back to lesser than, because I genuinely loved it. Didn't love the call, not going to pretend, but loved the nursing there. And that actually led me to many different opportunities. So I became the first certified or registered radiology nurse in El Paso. Which was really fun. And I had to, go out of town to train and take a test. And then that kind of opened doors to me to sit on certain leadership panels and committees and stuff within the hospital. And really, it just took off from there. I think I've always just been Allie. And so it didn't matter whether I was a nurse on the unit taking care of a patient or if I was in the boardroom as the CEO later in years.
Mhm.
It was still just Allie RN. And I think that's something that has resonated and really opened doors and helped me with many opportunities over time. But yeah, I laugh because no, never planned on being a hospital CEO, but there it was.
Allie, I've met several nurses that will say, like, I'll invite them to things like for the American College of Healthcare Executives, or I'll invite them to, like, oh, there's this exciting opportunity. And they will say things to me like, oh, but I'm just a nurse.
Mm,
And so, yeah. So how did you not fall into that trap of thinking I'm just a nurse? And how were you not afraid to grow and to take on more and to lead others?
yeah. So I love that you bring that up. And I think that's an issue, to be honest with you, and something that I'm hoping that I can make some meaningful movement with clients and folks that I work with.
Mhm.
But there's no such thing as just a nurse,
Yeah,
right? And really, it kind of goes with life. There's no such thing as I'm just whoever you are. I think our superpower lies in just us. What
yeah,
do we bring to the table? That authentic approach to life. But for nurses specifically, I think, we go through nursing school and we're taught essentially years ago that you're there to support the team, or you're there to help the doctor, or you're there to add in some way. But I think a lot of times we ourselves even forget that oftentimes we're that person at the bedside that notices the issue first.
yeah,
If we don't pick up the phone and say, hey, something's wrong, or we're not confident enough to say, hey, this doesn't look right, then it has the potential to have very consequential impact on the patients and their lives. And I think nurses in general, we tend to be, and I will just say, relatively codependent people. It's a habit for many people in the nursing profession. And so I think as we continue to grow, hopefully that kind of shifts. I will tell you, I worked for a lot of people over the years. Some I wanted to be nothing like, some I promised and swore I would never be anything like. But a handful of nurse leaders that I really, and I don't want to sound like a stalker person, but really kind of pedestalized. I watched them, I watched their careers bloom and blossom. And those that really had an impact on me, they did it in a way that was true to themselves. So
yeah,
they were still a nurse at their foundation. They brought that to the table, but they also had, further education on the business side of things, which was very appealing to me. So instead of going the MSN route, which a lot of nurses do, and we need that,
yeah,
I went the business route. And so I thought, okay, well, I have an undergrad degree, I have my BSN in nursing, so I want to get my MBA so that I understand the business side better. And I'll tell you, that's where I think for me, the biggest benefit came in.
mm,
And I feel like it gave me the biggest bang for my buck in regards to not just what I learned, but then what I brought to the table in the future.
mhm,
So falling in love with the operations side of healthcare and looking for ways to do things better and more efficiently and with better quality, those are things that, strangely enough, kind of feed my soul. Yeah.
yeah. Okay, so um, what would you say to somebody who kind of has that fear about taking steps forward, and how do you get people to get out of that mentality of I'm just this or I'm just that? Like what advice would you give them?
Yeah. So what I will say is you get nowhere in life without taking some risks. And sometimes risk, and I'll say that right now loud and proud, risk is scary as all get out. But I think at the end of the day, it's about using your voice,
Yeah,
understanding what your expertise is, being confident and comfortable in your expertise. If that's bedside nursing, if that's radiology nursing, if that's, really knowing diabetes education extraordinarily well, whatever it is that you're an expert at in nursing is part of who you are.
yeah,
And so the idea of we're all better together, When information or experience or background or expertise or value all gets siloed and we're all in our little box, we don't get to share and people don't get to grow with what we've been through. And so, people say a lot, grow through it. And I'm a big believer in that. And so I think I would encourage nurses or anybody in life, but nurses near and dear to my heart, take the leap. Your voice is needed and you're needed at that table. I find a lot of times we have that imposter syndrome going on and you're sitting at the big table or you're given an opportunity to speak somewhere and you think, well, why me? Or, well, why would they want me to do that? Or what would I possibly talk about or share? And I think in the end, if you really think about it, we all have something to share. And so if I had anything to say to those nurses, I would say, do it. Even if it scares you to death, nobody has to see the fact that you're shaking in your boots. You just get up there and you do what you need to do. But let your voice be heard. I think it's really important.
So well said. So well said. Okay, so one of my favorite questions for any healthcare executive is, what are you most concerned about in healthcare?
Yowza. So that's a loaded question. I need
Especially
3
now,
or
right?
4
It changes.
episodes.
It changes every time something
Yeah.
happens, but I mean, what are you now
Yeah.
today most concerned about?
So I think something that kind of encompasses a lot of what I'm worried about in healthcare, I would say what I'm worried most about in healthcare right now is the people.
Mm,
And so I think at the end of the day, sometimes we forget that there's doctors and nurses and ER technologists and pharmacists and all of these different individuals putting together this healthcare landscape that as a patient population, we all need desperately. And I think really getting back to the roots and focusing on the people.
mhm.
So whether it has to do with, who's owning and operating some of these healthcare companies. If you look at it, there's been a big shift. So now a lot of them are owned by big capital venture firms, looking to kind of build and expand and then sell and move on. Not saying there's anything wrong with that, but definitely brings kind of a different mentality to the table. I think, if you look back 30, 40, 50 years ago, it wasn't capital venture companies and huge insurance companies and things like that that owned and ran hospitals.
Right.
And so for me, I think really getting everybody back to the table, people that have practiced medicine, have practiced nursing, have been boots on the ground in the hospital and in healthcare, patients who have had great experiences and terrible experiences, being part of that conversation. I think making it appealing to legislature to look at change and get the right people at the table.
Mm,
But I would say if we can get back to focusing on the people, whether it's those providing the care or those receiving the care, I think it would make a world of difference. So, yeah.
love it. All right, so let's talk about the type of innovation that you've seen either in your past work life, or what kind of innovation do you find to be inspiring in healthcare today?
Yeah. So I think, everybody's talking about AI. Everybody's talking about technology. I'm not going to even pretend to be an expert on either one of those two subjects. But I will say, having run and operated hospitals through the COVID pandemic, we had to figure things out. And so, working somewhere, if you've got the hospitalist is sick and he can't come in today, but hey, we have this hospitalist over at this location. And so we're going to do it via telemed. And then watching telemedicine blow up as a result of COVID, right? And a lot of the challenges that we had. You heard about telemed prior to COVID, where I was working at the time, we had 100% telemedicine on our inpatient unit. But pre-COVID, we were the weird ones, right? Everybody was like, oh, how do you do that? How does that work? Isn't it terrible? No, actually, it's not. It's brilliant. And so I think seeing that expand through COVID and knowing that it's just going to continue to expand, I think it helps with access. I think it helps also sometimes you're one-on-one with the doc. I think a lot of times, you're in the office, the phone's ringing, they're calling him to a different room, all of these other things are going on. She's got 30 patients left to see after you. When you see a provider on telemedicine, you're one-on-one locked in with them for that short amount of time, but it's you and your provider.
Yeah.
So whether it's an APP or a physician, and whether it's a specialist or some level of primary or urgent care or something along those lines, I think there's still a lot of room for growth and expansion on the tele-platforms. I'm very grateful to have had the experience I had with that, and look forward to continuing to build that knowledge. But yeah, I think there's a lot of room there for a lot more to be done that way.
Excellent. And that certainly addresses things like access points and all the
Absolutely.
shortages that we have that we're faced with. So I
Yeah.
think you bring up a great point. So you and I had a side discussion about a concept that deeply hurt my heart when you brought it up. And we were talking about speaking of being worried about people, about this concept of weaponized incompetence, right?
Yes.
And what this phenomenon does to the people that we're working with and that we care about. So, what does weaponized incompetence mean to you? Like, how have you defined it in your career?
Sure. So I think, and again, there's different things from that perspective that happen everywhere. No
Mhm.
team is perfect. No leadership group is
Right,
perfect.
right.
I'm definitely not perfect. But I think at the end of the day, my success in team building has been from the perspective of being authentic,
Yeah,
owning it when I mess something up, because as I tell people, I will mess something up every day. I'll try to pick something different to screw up for you tomorrow.
yeah,
But I think having that authenticity, and ownership of your own faults and weaknesses, building a team around you that offsets that, right? So if it's something I'm really crummy at,
yeah,
like accounting, right? Didn't want to be the accountant. So I needed somebody really, really strong on the financial side. I think weaponized incompetence comes in, and what I would define it as is you can see leaders, right? I say the first thing is they lead with their title
yeah.
or they hide behind their creds. I think the second thing that kind of pops instantly for me now where I go, oh, I don't know about this one, is how they approach hiring,
Mhm.
and how they approach even things like your annual review, right? So for me, weaponized incompetence happens when you have somebody that's in a role that maybe doesn't belong in that role, or maybe, was blessed with a promotion before they were necessarily ready to be in that seat. And I think if you surround yourself with knowledgeable people, and you surround yourself with people that can lift you up, then you can be successful. But
Mhm.
I think if you surround yourself with people that you want yes people, you don't want anybody to ask questions or raise a hand. If you have somebody really strong on your team, you try to mute them, or discredit them, or steal credit for their work, or take credit for their work when it's theirs, not yours. I think to me those are all signs of what I call weaponized incompetence.
Right.
And so for me, really, it's incompetence. And I say this is one of the things I say, it's incompetence on crack.
Yeah.
And so when you take that and you put it in a high level in an organizational structure, or you put it in a position on authority on a team, it does a lot of harm
Mhm.
because people quit raising their hands, right? It's like a game of whack-a-mole. So you've been whacked too many times, you quit raising your hand. I don't have any ideas anymore.
Right.
It's really unfortunate, but I see it a lot. And unfortunately, like I said, it happens more than I care to admit in healthcare.
Right.
So yeah.
Well, and when you and I were talking about it, I kept thinking about historically when we think about where organizations have cultural issues, where they have operational issues, where they have issues.
Mhm.
We have historically called that, emotional intelligence issues.
Yeah.
Emotional, right? We've blanketed that
Mhm.
really issue as an EI issue.
Mhm.
People lack self-awareness. These people lack, and we continue to blanket it with emotional intelligence issues when really weaponized incompetence is such a um, more accurate description, a more really describes it to a T in my opinion. So I think that that's a great point and something that we've been blanketing as emotional intelligence issues. And something else that you just said, loyal descent. Have you ever heard of that concept, loyal descent?
Yes. Yeah.
which is what we want, right? We want
Yeah.
people to have loyal dissent, that they're on
Mhm.
our team and we value when they disagree with us because there's value
Absolutely.
them
Yeah.
telling us, giving us their
Yeah.
feedback.
I need the girl at my table that's going to tell me I have lettuce in my teeth at an event. And I absolutely want the people on my team that are going to go, Allie, we love you. That is a terrible idea.
Right.
Maybe if we did this or this. And I've loved that. One of my favorite stories with that, and it'll show the fact that I'm very grateful for it. I was running a bunch of urgent care centers. And we had an urgent care center that was not hitting its, volumes. And it was right in the same strip center
Mm.
as like a frozen yogurt place, right? And so I thought, oh, kids, ice cream. And so I had this brilliant idea that if you brought your child in for urgent care or whatever, you would get this coupon to use at the ice cream place. And of course, my entire team was like, no, 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 no. They're going to be all sugared up. They're going to be running all over the place. We're going to have ice cream dripping off the walls. And it is a goofy example, but it's a true one.
Yeah.
I really did think that that was a good idea. And thank God the team went, that's a horrible idea.
Yeah.
And as you grow and your responsibility is bigger, you need it more and more. And I think, I've been in rooms, there's a nurse executive near and dear to my heart that has kind of retired, semi-retired recently. And we've really kind of come full circle, right? Like she was a big time person at a healthcare company I worked for when I was a quote unquote baby nurse.
Yeah.
And I'll never forget the day that she broke the news. She was an admin director at the time. But she shared in, the nurse leadership meeting where Allie was just a nurse, sitting there that happened to be part of this group and this opportunity. And she shared that she was moving on. And I remember being this little baby nurse that had that woman on a pedestal because no matter how hard it was or how unpopular it was, she stuck with what was right.
Mm.
And so if she disagreed with an idea, she was respectful about it, but she would say, hey, I'm not sure. She tried to be this loyal dissent, right?
Yeah.
It wasn't welcomed in that institution.
Mm.
And so she moved on. And I'll never forget the hollowness I felt sitting in that meeting going, the only person in this room that had the nerve to stand up and talk to the hospital CNO and say, hey, no, I don't think that's a great plan, is leaving. Like, what are we going to do? Nobody else is going to do that. And so as time went on, I realized what it means to be a disruptor.
Yeah.
And I think probably the idea of loyal dissent is much more pleasantly worded than a disruptor, but I think it takes those individuals to
Mhm.
have the courage to, get whack-a-mole, but say it anyway.
Yeah.
And so, yeah, I love that. Absolutely love that.
Excellent. And we haven't actually talked about your consulting business now, but if
Sure.
you have some time, can you tell us a little bit about your consulting business and like who your ideal clients are or what you're focused on now?
Yeah, absolutely. So what I will say is I think the days of healthcare as it's always been delivered um, are numbered.
Yeah.
And if we don't come to the table and have conversation and figure out a better path forward, I think we're all in a world of hurt. Those providing the care, those receiving the care, everybody. And so my goal on the consulting side is kind of two-pronged. So I'm a firm believer that leadership matters. Who is sitting at the top and who's commanding or at the helm of the ship matters, and how they interact with their people. So definitely some leadership coaching and mentoring that I've started doing. And I've been doing that a little bit over the years
Mhm.
here and there, but really kind of diving into that. And then on the operation side.
Mm.
So as I mentioned, I think, these massive hospital complexes that we have, um, they serve a purpose and they have their place, but I don't think that will be the norm in 5, 10, 15, 20 years from now. So just like I said, the change with telemedicine and what that looked like, I think we're going to have these massive hospital complexes like we do now for, patients with multi-organ failure or patients that were involved in a horrific, trauma type situation. But patients want to get their care in their neighborhood. Patients want to receive their hospice down the street where mom and dad, can visit or whatever it is can park outside and come in and take care of you.
Mhm.
And so I think as we continue to kind of explore what the next page in healthcare is, just having a voice at that table and sharing my background and my knowledge, and some of the, I guess, experiences that I've had. So yeah, consulting, it's exciting to me. It's the idea of, like I said, I think we grow through what we go through, and I think we're better together. So the more opportunities I have to share knowledge and background and experience, the better.
Excellent. Thank you so much. Well, thank you so much, Allie, for spending time with us, talking about your career, walking us through your nursing journey and your leadership journey. I really appreciate the time you spent with us.
Oh my gosh, thank you for having me. I appreciate it very, very much.
Thank you.